So what are some things that can cause our blood pressure to artificially increase that maybe we would eat or drink in a day? Well, ephedra would be one of them. You'll find ephedra in energy drinks. You'll find it in weight loss supplements. You'll find it in Sudafed, the allergy medication that goes in the nose. And I absolutely have seen Sudafed cause palpitations and some symptoms that the patient was a little bit nervous about, and it ended up just being hyperstimulation from the Sudafed, the allergy medication they were taking. It's not just Sudafed, there's a few of them. So if it says pseudoephedrine on the ingredient label of your over-the-counter prescription that you're taking, over-the-counter medication, not prescription. If you're grabbing something from the shelves at the pharmacy, if it says pseudoephedrine on it, it could increase blood pressure, okay? What about caffeine? Caffeine can increase blood pressure, especially if we overuse caffeine. If we're drinking too much coffee, we're getting dehydrated because coffee's dehydrating. Or if we're drinking too much green tea. Green tea contains caffeine. White tea contains caffeine. Black tea contains caffeine. Not that that's gonna fix a blood pressure problem by getting rid of coffee and tea, no. In fact, some tea has some blood pressure lowering effects as well. However, keep an eye on it and just know that too much caffeine can cause increase in blood pressure. What about other teas? What about licorice tea? Licorice tea. Now, there's licorice flavored tea, that's fine. Anise, which is an herb, A-N-I-S-E, anise, that's an herb that tastes like licorice, that's fine. Licorice root can increase blood pressure, okay? In fact, I often use that in patients to help them bring their blood pressure up if they've got consistently low blood pressure at a certain point in their day. So what about herbs like Tribulus terrestris? Now that's a weird one for some, Tribulus, but you're gonna find it in a lot of athletic formulas. You're gonna find a lot of these blood pressure increasing things in athletic formulas, so watch it. Doesn't mean those formulas are bad for you. They're probably really good for you depending on what you're doing and how you're using them. But just be aware that if blood pressure's climbing, and you're like, what's going on? Look at the stuff you're having before you go to the gym. Performance things have a possibility of increasing blood pressure, so just look at it. Now, what about medications that we need to be aware of? Well, that's quite the thing. Did you know that Celebrex, acetaminophen, which is Tylenol, Advil, ibuprofen, Aleve, naproxen, can interact with some blood pressure medications? Now, I don't want you to freak out and go, oh my God, I just took an Advil, oh no, and I don't feel well. Don't worry. It's not that immediate. But I do want you to be aware that over-the-counter medications, along with prescription cardiovascular medications, do have an interaction potential, it's to some degree at least, as well as the herbs that we take. And so it's a matter of just, again, it's a matter of getting curious about it. It's a matter of getting curious. So that if we start to notice that there's some blood coming out in our stool, in our poop, we might want to think, I wonder if something's going on. Maybe I should ask my doctor about that. If there's really black stuff coming out in the poop, that could be blood from the stomach. Sometimes a combination of medications can cause bleeding in the stomach. Thins the stomach line, causes like drip of blood coming out. That way we're going to get a little bit of blood loss. And we think, oh, we're just having black poops. It's actually blood from higher up in the digestive system. Or if there's blood coming out, it could be from hemorrhoids, could be from an anal fissure, or it could be from an intestinal problem. There's lots of different things to look out for, but that's one thing that you don't necessarily have to go and tell your neighbor about. I know it's embarrassing stuff, but something to pay attention to, isn't it? Absolutely. So, these types of things can have, some of these painkillers can have significance with regard to stomach ulcers, as well as gastrointestinal bleeding, but also about the liver and the kidneys. And that's the thing that I want you to pay attention to. And that's the thing that I like to really pay attention to as a naturopath, is that when we take medications, and we're taking a combination of different medications, I just want you to bear in mind that those medications might have interaction potential because they all have to go through the liver and the kidneys. And so it's important to keep the liver and the kidneys as strong as possible, right? So when we have a cardiovascular condition, I'm not just looking at the heart. I'm looking at the liver and the kidneys as well, because I'm doing preventative work to keep the liver and the kidneys as strong as possible while you take your medications safely. That's my job.